Hey, what's up, folks? I intended to be on the road by now, but it's not happening. So I'm just going to give it a minute for some folks to get on in here, and I'll wait for you guys. I will wait for you guys to pop up in here. Hopefully I won't get kicked out or shut off again and that sort of thing. I am looking for some additional information that I gave the other night, but I'll wait for you guys to get in here. How is everybody? You guys doing okay? I'm going to be traveling really, really late today, but it's going to be okay. No big deal, right? No big deal. No big deal. So you know what? I'm one of those people that I either do one of two things when I get really angry. I either laugh or I cry. If I cry, it means I'm ready to choke you. So I'm going to continue to just laugh right now. Okay. All right. So let's talk about the PR meeting that we just had, courtesy of WJHL. Here's the thing that I want to know. Is, does anybody there actually do reporting, or do we just do interviews and let people just say whatever the fuck they want to say? Does anybody actually do a real interview in this town? That's all I want to know. Does anybody want to know the truth, or do you just want to hear the same PR marketing spin over and over and over? Like, that's what I really want to know. So I've had a couple of people tell me, and people pass me messages where WJHL said they were going to reach out to me. I have talked with John Engel for just a brief minute, and he and I are going to be meeting soon. But I just want to know, does anybody there actually know what reporting is, or even investigative reporting? Or we just call people up and say, hey, you want to tell us whatever it is you want us to know right now, and we'll be happy to regurgitate your fake numbers and bullshit all day. And it doesn't matter that people's lives are on the line, that people are dying. We can do that for you. We'd be happy to do that for you. Since you're a millionaire and nobody else around here is, and 20% of the population actually lives in poverty, and nobody can afford to travel an hour to traumas, and we just want to lie about how many babies we have and how many traumas we have. Do y'all want to know real numbers? So here's the deal. Just so far this year, the Holston Valley Medical Center NICU has had 268 babies. 268 babies this year. You want to know how many traumas Holston Valley Medical Center had today so far? Today, folks, today. They had 10. They had 10 traumas today. Of those 10 traumas, 9 of them were level 2 and 1 was a level 1. 4 of them would have had to travel over an hour to get to Johnson City had Holston Valley not been a level 1 trauma center. So let's talk real numbers, Alan, and let's talk reality. Let's don't forget Pikeville, Kentucky. Let's don't forget Southwest Virginia. Let's don't forget all of those things when we start to talk about these numbers and what's really happening. Nobody wants to line your pockets with multiple transport fees. Nobody wants to line your pockets when you're talking about limiting helicopter rides. Nobody wants to do that. And has anybody else ever tried to drive down I-26 at 5 o'clock in the afternoon? Anybody else besides me? Man, look. This was the second thing to piss me off today. I'm debating about whether or not to share this other piece of information with you guys, because it's serious and it's severe. And let me just go ahead and give it to you. All right. So here's the deal. Here's the deal. They have, when I say they, I'm referring to Ballad Health. They are moving the cancer treatment from Allendale, from the Allendale location, which was a 33,000 square foot facility that had 42 chairs to handle 78 patients. Now, I need you to understand that. Why am I so against Ballad? Well, Gary, let me ask you this. Is this my first live that you've watched? Or what piece of information do you not know that I have? Because I'll be happy to go over it all. But first, I'm going to give you this information. And maybe this piece of information by itself will explain to you why I'm so against Ballad Health. So let me tell you. So Allendale was a 33,000 square foot facility that has 42 chairs to take care of 78 cancer patients. Okay. They were leasing this facility, and I'm going to keep going, guys. So listen, they were leasing this facility, And this facility used to have a 34B status. Do you all know what a 34B status is? No? So 34B is a designation that you can achieve so that you get 35% off. You get a 35% discount on your services, okay, from the state. You can get this 35% discount, a 340B, if you are a rural referral service, and it's like 11.75%. If you're a RCC center, that's at 8%. Y'all listen to me. I want to give you real numbers. Fuck what he said on WJHL. It was a PR interview. I'm not interested. I don't even care what he said. And I know I don't like to curse, but he's made me angry. So just listen to me. I don't care what he said. Listen. So they came back and they said that they did not want to continue to lease a building. They wanted to move the cancer center from Allendale to Indian Path. And the reason why they wanted to do that, okay, was because it would go from being physician-based. Physician-based means that I'm going to come see my doctor and I'm going to pay a $20 copay to get my treatment. Do y'all follow me? So I'm going to my doctor's office. I'm going to pay a $20 copay and I'm going to get my chemo treatment. That's what I'm going to be able to do because God forbid, I'm worried about dying. So I just want to be able to pay my $20 and keep it going. Well, because Ballad wants to get that 340B status back. They're 70% complete, guys. They're moving the cancer treatment from Allendale to Indian Path. It's scheduled to be completed January 20th. It's 70% completed now, and the COPA compliance officer has not even been notified yet. Now, let me tell you what happens now. So now when these folks want to go for cancer treatment, they now have to pay their copay and a facility fee. They have to pay a facility fee because now you're in a hospital to get treatment instead of at a physician's-based office. Are y'all following me? So now because you're not physicians-based, you're hospital-based for your treatment, and you've gone from 42 beds, and the new facility is supposed to have 49. Now this facility fee that they have to pay on top of the copay is $130. So now if I'm a cancer patient and I want to go get my treatment done, I have to pay $20 plus $130, which means I need to be able to pay $150 for my chemo treatment simply because Ballad wants to get the 340B status back because it will allow you to have 35% off of your medications. Well, guess what? Every prescription that is going to be written out of that facility, guess where it's going to go? The prescriptions are going to be sent to Mountain State's pharmacy. So that means the pharmacy is going to get a 35% discount on those drugs because you have to pay an extra $150 and you qualify for 340. They qualify for 340B, although you are out almost 8 times the money that you were spending to get a treatment. You are talking about millions upon millions upon millions of dollars. Do y'all know how much medication cancer patients have to take? And so that Ballad can get 35% off of those medications, they moving everyone from Allendale to Indian Path. And patients are going to have to pay almost 8 times their copay. Y'all follow me? I didn't just pull these numbers out of the air. Y'all know people are talking to me, right? You want to know why people are talking to me? Because I don't work for Ballad. You can't do shit to me, sir. And these people know I'm not going to tell you their names. You're not going to know where I get information from. And I'm getting a lot of it. A whole lot of it. So now let's keep going. Let's keep going. Let's keep going. So the new facility will only have 49 chairs. They only had 42 so far. You got 42 chairs, 78 people, and every chemo treatment is about 4 to 5 hours, right? Now, some chemo treatments are 10 hours. How do you balance 78 people in 42 chairs? I'm going to keep going because I got so much to tell y'all. So now do you want to know the rest of it? Let me tell you the rest of it so I can be really, really, really angry. So now cancer patients are being told that when they go for, let me get my notes out. When they go to radiology for their MRIs, for their PET scans, for their CT scans, they have to pay for those up front, or they are not allowed to get them done anymore. Now, let me just tell you something. If the oncologist cannot get an updated PET scan or a CAT scan, they don't know if the chemo is working. So they don't know if they want to raise the chemo, lower the dosage. They can't send a report back to the insurance company so that the insurance company knows what's happening. And that means the insurance company is going to stop paying for the chemo. People will die. This is real. This is happening right now. Cancer patients are being made to pay $150 instead of a $20 copay. And if they don't have, and I ask, what's the average cost for these, for the radiology? What's an average? The average they told me was $300 to $400 for these tests. Who do you know in the Tri-Cities area that's just got $300 or $400 laying around for some tests? I don't know too many people that have it. But you want me to believe that you have this region's best interest at heart? I don't believe you. Not from your shifty eyes to anything that's coming out of your mouth. And your track record speaks for you, sir. Everything that you all did at HMA, everything that you and Melody put together there is exactly what you're trying to do here. And you're doing it at the expense of people, and they will die. And let me just tell you what their marketing team said about this, folks. This is a direct quote. This is a direct quote. Cancer care is not a patient right. Cancer care is not a patient right. Really? It's not? When they were asked about the impact, it's called patient impact. Patient impact. What's the impact to a patient who has to go from paying $20 for every chemo treatment to $150 for every chemo treatment, and then they have to pay $300 to $400 out of their own pocket just to see if the chemo was going to keep them from dying? And then their marketing team wanted to know, well, how can we spin that? How can we spin that? How can we spin that? And their spin was, well, you can either do it this way or go outside of the area for care because we won't be able to treat you. This is what happens when you have a medical monopoly, folks. This is what you have when you have a medical monopoly. So you have people who have cancer, and all they want to do is live. You have parents who have NICU babies. By the way, let me just tell you something. Do y'all realize how many babies from Indian Path are full-term babies, but they're exposed to drugs? So they still need to go into the NICU? Let me just give you some numbers. Told you, I love people. I love, let me tell you something. You all might be speaking through me, but you are speaking. Every single one of you who has showed up and emailed me and sent me information and sent me documents, you are speaking up. In Indian Path, 25% of the babies in Indian Path are exposed to drugs. 25%. You have full-term babies that still need NICU care. And I've said it before, and I'm going to give you the numbers again. I'm just going to give you like the last three. Let me give you the last 3 or 4 years of NICU numbers. You ready? 2015 had 294. 2016 had 264. 2017 had 268. And 2018, as of last week, had 268 babies. That's an average, folks, of 24 NICU babies per month. So when you say 7, which by the way, last week you said 8. So let me just give you a little tip, Alan. When you lie, like, I need you to remember it. That way you can just tell the same lie over and over again. Like when you keep moving the numbers, we pick up on it. I mean, we knew you were lying anyway, but when you go from 8 to 7, from 24 to 29, at least act like you don't know that we're smart. Like at least act like you think we're, what? Come on now. Holston Valley Medical Center had 10 traumas today. 9 of them were level 2. 1 was level 1. When he talks to you about, you'd still be able to go to cardiology. If you had a heart attack, you could still go to a level 3. Yeah, you could go, but guess what? There's not a cardiologist on staff for you. Level 3 trauma centers are not required to have specialty doctors there. They are not. A level 2 has cardiology. A level 3 does not. So sure, you could go to Bristol. You could go as a level 3. You could go. They can run tests. They can do all of that and then transport your ass all the way to Johnson City so that you have even more medical bills, because surely to goodness, that's all people need is more medical bills in order to try to live in a system where you want to get a 35% discount on your daggone prescriptions. So you're going to be willing to let cancer patients pay 5 and 6 times what they're supposed to. Meanwhile, your ass was in St. Augustine, Florida this whole time. The only reason that you're in Tennessee right now, sir, is for your board meeting. So please don't try to act like you're one of us, like you live here, like you know what it's like. Yes, I heard about the cath labs too. This is real facts. This ain't nothing made up. This is nothing made up. And let me tell you something, news organizations in Bristol and in Kingsport and in Johnson City, you have a responsibility to the citizens around you to tell the truth. There's a reason you're supposed to have free press, and it's supposed to be to tell the freaking truth, not what somebody else wants you to peddle and push for them. You're not supposed to be an extension of their marketing department. That is not supposed to be your role. Your role is to dig and find the facts. And it's funny because I didn't know jack shit about Ballad Health until 5 days ago, sir. And I know more than every single one of your reporters combined. And I have the documentation to prove it. Get on my nerves, like somebody's supposed to roll over. Folks, here's what I'm going to tell you. Between now and December 13th, I'm coming home. And I'm coming home and I'm armed with a lot of information. A lot of information. It is your representatives deserve answers. They deserve to give you answers. You deserve answers for this. You deserve to hold people accountable. I'm not against you getting a 340B certification or classification. I'm not against that. I'm against you doing it at the expense of people. I'm against you doing it and increasing costs for cancer patients from a $20 copay to $150 copay. I'm against it when you want to take people who are already trying to fit 42 chairs with 78 patients and then put them into another facility and then require that they have to pay for all their PET scans and their CAT scans. Do y'all understand? Like, people will die. People will die. That's a fact. Listen, those are not reporters. Those are regurgitators. Those are tell me what you want me to say and I'll say it. That's what those are. telling you, I have become more sure in the last week of what's important to me than I ever have been. The idea that people are just going to sit back and let people take advantage of you and railroad your hospital costs, and people are dying in the process. This is not okay. I'm not good with political corruption. I'm not good with corporate agendas. And I'm not good with you making millions of dollars on the backs of poor people. I'm not good with that. And I'm going to say something, and you can talk about me like you want to. You can do whatever you want. That's why you blocked me on Twitter. I'm good with that. Him talking about, oh, I'm open to having a dialogue. No, you're not. No, you're not. Not unless you think you can get the best of somebody. When you talk to somebody who can meet you where you are and call you on your bullshit, you don't want to talk to us then. Hey, Tico. Guys, I have facts. I have proof. I have proof that they are killing people with these decisions. Yeah, Kayla, he blocked me on Twitter. And the thing about it was he tweeted me first this time. Like, I didn't even ask for you to engage with me. But then you thought you were going to, and I had to correct you on the shit that you misquoted, and then you wanted to block me. A support group fund, I'm down with that. Here's my, this has been, so I believe in being transparent. It has been really difficult for me to focus on regular work and regular life because my heart is in this. My heart is in this because I don't like what I'm seeing. And I'm hearing stories of people who are scared for their livelihood, and people who are scared of their jobs, and people who are scared because they're not going to be able to get treatment. It's like people are either going to die because they can't afford the treatment, or people are going to die because they won't have jobs. It's not okay. It is not okay. Guys, I care enough about this. I went and got an encrypted, secure email address so that people could send me documentation. I'm coming home. Tico, this stuff right here is killing me. This is where I'm from. This is my hometown. And these two hospital systems have merged together to create a monopoly where 2/3 of the region, they have control, 75 to over 90% control of the inpatient treatment in that area. What do you do if you want a second opinion? What do you do if you need another cardiologist? What do you do if you don't agree with what they're saying? What do you do if you say, hey, listen, I don't want chemo, I want something else? What do you do? I've just gotten to the point in my life where if we don't fight for something, what are we here for? If we don't fight, I know you guys are scared, but if we don't fight, what are you here for? I am not here to watch cancer patients die. Oh, Teresa, honey, I can't live there. I got a lease here. But I will tell you this. Here's what I will tell you. I am going to set something up for the people who do want to support me to be able to do this. I am going to set up a way for you all to be able to do this. Because here's what I know. I know that this matters. And there's almost 1 million of you. You know what, Tico, that's exactly what I said the other day, because my grandbaby was born at the NICU that they want to close. She was 1 pound and 3 ounces at birth. And here's what I know beyond a shadow of a doubt. She would not be here if it was not for that staff. She would not be here if it was not for that facility and those people. So I'm going to tell you now, until the highest courts in the land tell me otherwise, we are going to fight with everything we've got, whether that means a class action lawsuit, whether that means contacting the ACLU, whatever that means, that's what we do. That's what it means. That is what it means, because you don't make millions of dollars off of the lives of people. Where do we do that? Why do we do that? You don't do it. It's not okay. It's not right. So yeah, this is where we are, folks. This is where we are. And you just want to sit on TV and lie as if people don't matter. People matter. Poor people matter. Country people matter. Hillbillies matter, regardless of what you think. Whew. Okay. I'm going to get off here, and here's what I'm going to tell you, okay? If you have documentation, if you have information that I need, you inbox me. I will give you my secure email address. And I promise that by the end of this week, I will set up a way for you guys to be able to support what I'm doing. And here's what I promise. As long as I have the ability to do it, however that looks like, I will get it done. Okay? I got to eat and that sort of stuff. But as long as I can eat, and as long as I can take care of what I got to take care of, and that's not just for Ballad in Bristol, this is anywhere. When we finish here, which we might be in this one for a minute, but when we finish here, we'll move on to the next one. I truly believe that it's things like this that are going to bring us together across the board. Oh, this is the thing, Connie, it does. This is what I need everybody to understand and to know. Everybody keeps asking if I'm a lawyer. I don't. We need to get one on board with us. I'm not a lawyer. I just sound like one, apparently. But this is going on everywhere. There are hospital mergers going on everywhere. There really are. And that's what's caused the FTC to start to have, the FTC had 3 roundtables this year. And these roundtables were in reference to exemptions and immunities. And they're talking about how much power are we giving these hospitals when we give them immunity to antitrust laws. And that's what's happening. Like literally that's what's happening. So here's what they're telling guys. So the growth back home, the growth where you guys are, you all know this, right? The growth, Stephen, I'm down with it. Inbox me. The growth where you are is like, it's an older population there now, right? And so like, I've got all the statistics. I've got all the growth numbers that they want to use against you. I've got all the socioeconomic numbers. Here's my point. So this is where we do a full-fledged well, Susan, check this out. I don't know which side of the fence you're on or which side of the town you're on, like Virginia or Tennessee, but it was one of our senators that actually passed legislation that helped this happen. It was Rusty Crowe, and then Gary Hicks passed another one because the existing COPA law did not allow for this merger to happen. They actually passed a law that made it okay for this merger to happen. Well, from what I hear, Kim, somebody talk to Eastman, because from what I hear, Eastman's in bed with them. I hear Eastman is, and I hear ETSU is. I know ETSU is because one of their doctors is on the meeting that I'm supposed to have with them. Yeah. So, holy geez. Yeah. So Susan, you guys are going to be in so much trouble. If they don't, here's what I need you to understand, love. if they downgrade Bristol to a level 3, even if you're in Bristol, Virginia, yes, the government can stop them at this point. Thank you, Daryl. One of Eastman's VPs is on Ballad's board. So the hope that we have to look at two different issues. I need a lawyer to talk to a lawyer whether or not there is any type of I know it is. I went to school at ETSU. I know where it is. What I'm saying is they are working together. So here's what I'm saying is okay, so even if you live across the state lines, the Virginia State Police cannot transport to Johnson City. They can't. The only way they can transport to Bristol, because it's Bristol, Tennessee, Bristol, Virginia. So because it was a dual state city, they could transport to Bristol. If Bristol's downgraded to level 3 and you have a level 2 or a level 1 trauma center, the guidelines say that you have to be transported to the nearest appropriate facility, which would mean someone transporting you all the way to Roanoke. That's what it would mean. 2 hours, two and a half hours away. People will die, folks. All right. I wanted to share the cancer information, the cancer treatment information with you. I wanted to reshare the real NICU numbers from Holston Valley Medical Center, since the CEO of Ballad Health likes to go on TV and lie. I wanted to tell you about the 10 traumas that were at Holston Valley Medical Center today. 9 of them were level 2 and 1 of them was level 1. Absolutely, Gary. This is where we pull every resource known to man that we have. I know, Teresa. So a lot of the doctors, I have talked to people, and people have said that the conflict for them is they want to be there for their patients, but the way that things are going, it's not even like, it's not for the patients anymore. Patient impact is negative. And when they talk about, oh, well, we don't have facts and we don't have guidelines, here's the deal. The only level 1 would be in Johnson City, Justin. They want to downgrade Holston Valley's level 1 to a level 3, and they want to downgrade Bristol's from a level 2 to a level 1. And I went over what that means for everybody the other day, but the bottom line is, at a level 3 trauma center, you do not have one single specialty that is available in the emergency room, not cardiology, not neurology, not any of it. None of it. So, yeah. So it's time to put this thing together. It's time to put this thing together and right the wrongs that they are doing. That's what it's time to do. So I'm going to go because I still need to get on the road, and it's going to be a really long drive for where I need to go. So yeah, Tico. So this was, so we need to chat, sis, because I agree. We need to put something together. And I can tell you everything that they want to do in this region, it's going to affect 1 million people, and everything that it involves. They want to downgrade 2 trauma centers. They want to only have 1 trauma center within about an 85 to 90 mile radius. That's a level 1. They want to close the NICU where my grandbaby was born. That is the most successful NICU there is in that region. And they want to move all of those NICU services to Johnson City. So there would be no NICU. There would be no level 3 NICU. The only level 3 NICU would be there. There would be no NICU in Bristol, no NICU in Kingsport, no NICU anywhere. Like literally 1 NICU in about an 85 to 95 mile radius. And here's the thing. You guys are welcome. But here's the thing. When he says this is what guidelines tell us, and this is what they tell us to do in different populated areas. Listen, if you have not had the American Association of Pediatrics come to this region and do a study and do a full-blown consultation, and if you have not turned those documents over to the state health department and to the public for review and had it reviewed by an independent consultant, shut up. Because I'm tired of you reading stuff off the internet and acting like it applies to this region. The American Association for Pediatrics will give you a guideline, but that is not region specific. Right, I know. So Susan, I know. I looked at all of Abingdon stuff. I know about their pediatric center that they have there. I know that they had to hire a pediatric specialist to stay on staff because they weren't able to staff it any other way. They are not going to be able to hire pediatric specialists. They're not going to be able to hire pediatric surgeons for these these pediatric trauma centers. It's not going to happen. You want to know why? Because doctors don't want to go where there's less than 50,000 people, and you're not going to pay them enough to want them to be able to go. Period. Okay. I'm done now, for real, this time. Those are the things that I promised you. I will keep you all informed. I will do a more calm, in-depth live about the cancer information that I just gave you today. I had some more information sent to me this afternoon that I still need to review, but we'll do all of that. Yeah, I know, Joshua. That's what he does. So, yeah. I know, Jennifer. I know you guys are worried about your jobs. Oh, Justin, which numbers are wrong? Please share with me. What numbers did I give that's wrong? Tell me. I'm listening because I don't want you to think that I'm not willing to listen. Please tell me, Justin. What numbers do I have wrong? And I guess my second question would be, do you work for Ballad? Roanoke isn't the closest what? No, you wouldn't. Not if you needed to be transported by Virginia State Police, because they cannot transport to Johnson City. The only reason they could transport to Bristol is because Bristol is Bristol, Tennessee, Bristol, Virginia. No, it would have to be Asheville would be even further for them. I mean, I'm not telling you stuff like for shits and giggles. It's literally the documentation that I've been sent by the transport folks. Like, I literally have all the guidelines. If you could see my living room floor, I don't even have a floor. Sir, I'm not quoting stuff just to be quoting stuff. Good Lord. Right, but the point is, Carla, if they downgrade Bristol from level 2 to level 3, they won't be able to just take them to Bristol anymore. Because if you're downgraded to a level 3, that means you don't have any specialties there. You don't have any specialties there. At a level 3, you are not required to have cardiology, hematology, neurology. None of those are there. Thank you, Jody and Ches. Thank you. Just saying. Let me tell you something, folks. Before I get on here and tell you anything, I look it up. I review every document. That's why I've pulled it all off of here. Hey, what's up, Jason? No, you're good, Carla. No worries, love. And I know that I get really, really animated. I know that I get really, really animated. I was cool. Thank you, Tanya. That's the point that I thought I was making clearly, but maybe not. This is the point, guys, right? Yeah, I know. Yeah, like I literally, because listen, as I'm researching this stuff, part of me goes, oh, I don't want this to be true. 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 Because the more that I find that it's true, the more I realize how much disregard for human life has to be present in this plan. Like, guys, they have been planning this for 3 years. They have been planning to do this to you for 3 years. Do you all know that downgrading, like combining your trauma centers, was in the COPA? It's in the COPA. The state health department knew that they were going to merge your trauma centers, and they agreed to stay out of which one it was. They won't, Teresa. And so, like, when they talk about this telemedicine, let me just tell you guys this. Think about this telemedicine when you talk about Wise County and Lee County and all of that, right? When you think about that, you're lucky to get a damn cell signal in those communities, much less a freaking hospital FaceTime. Think about that. If you can't even get a damn cell phone signal, how are you going to have a hospital FaceTime? It makes no sense. It's useless. All right. So listen, I'm going to recap this because Kathy, you're in here. And if you are interested in cancer care, here's the deal. Bottom line, they're moving the cancer treatment from a physician-based facility in Allendale to Indian Path so that it's a hospital-based facility. When you do that, these patients are no longer going to be able to pay a $20 copay. They are going to have to pay a $20 copay and a $130 facility fee. That means a cancer patient is now going to have to pay $150 to come and get treatment. Now, by putting all of these services into this area, the percentage is going to be enough that they are going to get a 340B designation. A 340B designation means that Ballard will get their medications 35% off. Well, those medications will be sold to them by the pharmaceutical companies at 35% off, and all of the prescriptions written at Indian Path will then go to a Mountain State or a Ballad pharmacy. So that's literally hundreds of millions of dollars for them over time, because they won't be paying cost for those prescriptions, and yet the cancer patient is going to have to come out of pocket more money. And then at the same time, for when you go to radiology, for MRIs, PET scans, and CAT scans, they are now saying that you have to be able to pay your copay, your part of that up front, which your percentage is generally on average. No, Brenda, no, they don't. They lost their 340B pricing in 2016. And the reason why they lost their 340B pricing in 2016 is because they started moving some of the patients that were in Allendale to Holston Valley, so they fell below the 11.75%. So when they fell below the 11.75%, they lost it in 2016. So they want to get it back. So that's why they're doing this move. And in the meantime, if folks cannot pay their copay for their radiology stuff, for their PET scans and all of that, which is on average maybe $300 to $400, if they can't pay for those tests, then the doctors, their oncologists, can't see if the chemo is working. Well, if they can't see if the chemo is working, they can't write up reports to the insurance companies. The insurance companies won't keep paying for chemo. And then guess what? People die. That's what's happening when it comes to cancer care. Those are the facts. The new facility is already 70% built, and COPA doesn't even know about it. And then you want to get on TV on WJHL and say we're doing what's in the best interest of the people. I call bullshit, sir. maybe I don't have 20 years in hospital experience, but your 20 years in hospital experience is is either learning about Medicaid fraud for the government or working for a hospital who engaged in it and has to pay $260 million because of it. Oh, he said Ballad employees could speak out, but if you speak out as a Ballad employee and you speak out in a way where, you know, it doesn't look good and it's not necessarily factual, in other words, his freaking facts, then that's a problem. So in other words, hell no, you can't speak out. I can read between the lines. Just telling y'all. This is what you're up against. And anybody, if Larry, so do you want, let me just give y'all the name. Larry Fitzgerald. Larry Fitzgerald is your COPA compliance officer. I have yet to be able to get a hold of him. But here's the deal. If your COPA compliance officer takes a look at all of this information, which is factual, which can be documented, which can be researched and proven, this is a violation of the COPA, period. It's time to call a halt to this. That's what it's time to do. All right. So everybody who said you want to send me stuff, you want to be able to help, I promise I will set up a way for you to support. I will do that this week because it's been brought up to me several times, and I get it. And it is necessary. We're gonna dig in and make this work. But yeah, I do gotta go because I still have to travel. So I'm gonna go. If you are new to this live for the very first time, the way that I end every single live is I say three things: be amazing, be light, and be love, folks. Okay. Oh, hey, wait. Jackie popped in from WJHL. I got you, Jackie. Let's talk. Let's do it. I'm down for that. All right. Peace out, guys. I'll talk to you later. Bye.